Tomorrow is the good doctor lined up, ready to go. It's Dr. Dan Edney. He's a member of the Mississippi Coronavirus Task Force, former president of MSMA, and also the MD Chair Physician Disaster Relief Program for Mississippi State Medical Association. Good morning, Doc. How are you, sir? It's good to have you.
Good morning. I'm well. How are you?
I'm doing good. Where are we today as far as most of the testing centers or vaccination centers being back up and running?
The vaccine centers are all back up today with the exception of Washington County, which will be up tomorrow. As you know, the Delta was hit harder than anywhere else in the state and just was not ready to be back up for today for safety reasons, mainly safety of the public, but also safety of our workers there. But everybody else is up and running.
Yeah. Are the hours going to be basically the same thing, or have they been constricted in any way, or are they going to go back to where they were last week or week before last?
Actually, they'll actually be longer. We are going to work hard this week to try to catch up with some extended hours, and also some weekend appointments. And so anybody with questions regarding their appointment, everybody is automatically rescheduled from last week and will be notified by email, the email that they placed into the system when they made their appointment. And we're going to work hard to try to get caught back up and then back online. We had over 100,000 vaccinations given the week before the storm. And we want to get back to that and more.
I'm sure you have some glitches here and there, but for the most part, we went through the first one and the second one in Canton from the National Guard there. And I mean, those guys did an incredible job. The second one, on the second vaccine, it was backlogged a little bit more, but these people, as far as efficiency, I don't think you could do any better than that. They were in total control of all of the paperwork that needed to be done. And I haven't heard a lot of problems with any of the locations, other than just there are a lot of people in Mississippi who want to get the shots, and they're ready to get them done.
Absolutely. We're so glad that everybody is wanting to get it and standing in line to get it, because that is our surest way out of this mess, is through vaccinations. But it's been incredible to learn just the complexity of operations just to get ready for one vaccination drive-through clinic, and the cooperation between the state health department and the National Guard has been phenomenal.
What is the black population in the state of Mississippi? Does it compare to other states? Are we behind or about average, or can you even track that?
No, we do. We track it very closely. We're, as you know, the state is about 1/3 African American, and we're running a vaccine rate of about 17%. And the health department has strategies working with community leaders to try to get those numbers up. We want to be vaccinating at a higher rate than than 30% as soon as we can. But we're about 12-15% lower than we need to be, and a lot of that has to do with the need for the drive-thrus to get our numbers up quickly, which is not as conducive for our African American population, but still necessary. So we're looking at other routes in meeting the needs of our black population, especially in the counties showing a lot of disparity around the state.
Well, you said 17%. What is it nationally? Is that fall in line as far as nationally is concerned?
Well, from a national standpoint, we're running lower nationwide just because of there are concerns in the African American population regarding the vaccine. Those concerns are being eradicated through education and through leadership of our black physician colleagues and African American pastors and African American leadership nationwide. The numbers are coming up. We just want to get them up faster.
Are you telling me that it's around 30% for the white population, Caucasian Americans, compared to 17% for African Americans?
Yeah, out of the vaccines that were given, that we're running about 70% are going to white Mississippians, which is pretty close to what the population is. Very low with non-whites, and about 17% for African Americans.
How do the Hispanic Americans in Mississippi play into that?
Well, that population percentage-wise is very low, but we're running
Yeah.
less than 5%.
That said, when you look at it, have you had any reports of negative reactions? I don't care what it is, if it's the flu or anything else. Some people are going to have some negative reactions. But I haven't heard a lot, other than maybe some minor things where people had some soreness and things like that. But any that required maybe hospitalization or a doctor's visit, have you seen a lot of that?
We've seen very little. You can expect your first shot to be pretty easy. We expect the second shot, which is the booster shot, to cause more of an immune response. And so when you hear people talk about running fever, feeling achy, fatigue, that's the immune system doing what it's supposed to do. It thinks it's fighting the coronavirus. Now, if you have had COVID and you're getting vaccinated, that's probably going to be the most vigorous immune response, but that's okay. That's your body doing what it's supposed to do. And we just try to prepare people just to be ready for those symptoms and be ready to treat them. The vast majority of people, though, do very well. I felt little to nothing even with my booster shot.
I haven't heard it before. So if you've had COVID, and you need to wait how long to be symptom-free before you can get the shot if you've had COVID?
Yeah, once you're fully recovered from COVID, and that's working with your physician to determine when that is, then you need to get vaccinated as soon as a dose is available for you. Unless you had the monoclonal antibody treatment, then you need to wait 90 days.
Well, and the other part, too, to play into that 17%, I'm guessing that you haven't seen any ill effects from the African Americans from that 17%. That would be commensurate with the Caucasian Americans. Isn't it probably no different? To allay the fears, there's not a large percentage of that 17% that have some negative reactions.
That's correct. And I would say it's probably less fear at this point among our Black Mississippians versus having more difficulty with access just because of the way the vaccine had to be rolled out. So we're looking at ways to improve access to that community that's seeing disparities.
What is the latest that you see as far as the morphine of this virus changing a little bit? We did see that in Mississippi in one or two locations. What's the latest on that?
Yeah, and we know the variant. We knew the variant was in Mississippi. We just had to catch it. But the good news is that our two FDA-approved vaccines, Pfizer and Moderna, are still doing well against the variants that we know. And, the virus is doing what viruses do, and that's mutate. And the more they feed and the quicker there's transmission and turnover, the more likely they are to mutate. So the way to stop the formation of new variants is get the immunity in the population up, put the fire out. We do that through vaccination. Vaccinations are the answer to the variants.
Do we have any idea when that next stage of the population will be admitted to come in below the 65?
Well, let me update you where we are. Today we have 1.2 million Mississippians who are eligible for the vaccine, and we have administered over 330,000 first doses. We've administered over 470,000 total doses. That would include first and second. But looking at first doses, out of 1.2 million eligible, we've gotten 333,000 plus vaccinated. And before the storm, we were up to 100,000 doses, vaccination doses a week going out. So it really doesn't make much sense to open up another category until we get caught up with this 1.2 million. Because basically, when you leave this 1.2 million, you're talking about healthy people.
I got you. Very informative. I thank you for spending some time with us. I appreciate it very much.
My pleasure. Greetings from your good friend of mine, Dr. Thomas Dobbs.
You got it. Dr. Dan Edney, member of the Mississippi Coronavirus Task Force. Got more to talk about coming up.